Go.
Hello, my name is Victor Preston. Today we will be doing how to change a ostomy and also emptying the contents in the bag. So first of all, we'd gather our equipment, which will need a basin to put the stool in, and we'd also have our measuring template to measure the stoma. We would have, which is part of this too, we'd have our gauze pots to put on the stoma when we're not, when we're setting this up. So we don't want the stomach to be open in any area. We'd have our ostomy bag and our, what do you call this thing again?
Wafer.
Wafer. And then our keynote, I don't know what to call it. Clamp. And then obviously scissors and scrubs. So I would introduce myself to my patient. Hello, my name is Rick Chris. Doctor has ordered a change of ostomy. Well, nice to meet you. Can you also tell me your date of birth?
My birthday is June 27, 1994.
Now check both patient identifiers, and I would explain the procedure. So basically what I'm going to do is I'm going to be changing your ostomy bag. It's getting kind of full, so I'll be doing that. So if you have any questions or concerns, please let me know, and we'll get this cleared out for you and have a brand new ostomy bag.
Okay.
So, sure.
Now I'm going to put on gloves and empty the ostomy bag into the pan. And you want to use a towel and put it under the patient. Oops, sorry. Yeah.
And the trash can.
And open the clamp. And empty the bag. Did I close the bag?
You can close it when it's not in use.
Okay. Yeah.
Wipe it off.
Okay, so one person does one.
And we'll wipe it off. You want to wipe the lower end of it. And close
Not
it
willing
back.
to try.
Now we're going to take it off. There we go. It's off. Now where do I put it?
You're gonna rinse it.
Put it
You get that difference in your sink.
invisible bag.
There we go.
Do I leave
Put
this on?
something over that. Sorry.
Well, she's about to take that off too.
Oh, I'm taking this off.
That's why I was like, we're gonna have to do this video again.
No, that's fine. And then you want to wash it with warm water and lay a tissue on top of it. Somebody want to do this? Measuring and applying the new one?
Girl, you want some gloves on? Yeah, you do.
I'm gonna put on gloves, and then right now what we're about to do, we're about to measure the stoma and check it to make sure it's still red and pink. I mean red. Bright red means it's okay. Pink, pale pink means it's bad and that we need to contact our physician. I don't like this one, so I'm going to use this one, and it's basically the same thing. You're going to measure your stoma so you can understand how you're going to cut it out. So I'm going to look. Oh, look at that. It's bright red. Awesome. And you don't want it too big, but you don't want it too small. That's going to irritate. And you want to try not to touch it because there's only one. And I'm going to say that I'm going to use this circle to cut it. And I'm going to cover that back up. Yeah. You don't throw these away because we only have one per patient. So you're going to put it in an area in the room where it can be easily found whenever you use it.
Yeah, you get like you hold it and peel the push the skin down.
You're gonna trace the circle out onto here so you know exactly where you need to cut. And when you're cutting, it's safe to do 1/8 of an inch, a little bigger. So you're gonna start in the middle and kind of just go out and just go a little more than what you circled. And you're gonna go around.
That's the only one that's hanging out. Okay. For cleaning, probably right, and then the prepping. Yeah, but pretend you got a warm rag in your clean it.
And you can just throw this part away because you're not gonna need it.
Just put it on this side.
Yeah, just throw it somewhere.
And now you're gonna go skin prep around the area. It's a protectant and it's gonna add a little extra stickiness to keep it in place. You're gonna try to avoid touching the stoma because it can cause an irritant to it, and you're gonna leave it there to dry. Normally we'll have the little just to cover it back up so the poo-poo don't.
And we didn't see any pus or drainage coming out of the stoma.
Now we're going to use our body heat to make sure the edges of this wafer is smooth because we don't want no irritates to our patients. And look at that, it's all pretty. Wonderful. And now we're going to place our new wafer onto our patient. And I'm going to put this right here because I'm going to cover it again. You will use body heat to make sure that the wafer stays in place. So you will have your patient harden their abdominal muscles so it's easier to put this in place. And let's just say it's there. Awesome. Body heat has activated it. We will cover it back up because I'm going to come back over here and get your bag. Your bag is in place. We're going to clamp it off before we put it on the patient. You're going to clamp it that this edge is facing away from the patient.
I want to say they're locked in.
And make sure it's clamped good or it's going to spill all over the place. Yeah. And now we're going to put this on our patient. We're once again going to have them harden their abdominal muscles because it's hard to push this on when they're not. And we're going to kind of press it down. Make sure you go all around the edges. Make sure it's in place properly. And that is done.
And we'll leave 5 minutes.
You rinse it in the bag. You rinse the bag in the bag. The toilet thing. The old one, right? Yeah.
Alright, and now we're going to switch off. And somebody's going to show you how to clean up the rest of the room.
Okay, so I start off by getting clean gloves. So I'm start off by washing up the old bag. Oh, you gotta cover him back. First, I will cover the patient.
Yeah.
Get rid of this.
You're going to do what with it? Throw it in the toilet.
And in the bathroom, I'm gonna go ahead and empty this out. And I'm gonna wash it with the hose. I'm gonna wash this out, clean it, and leave it in the bathroom so that it's ready to be used for the next cleaning. And then next, I'll be cleaning out the other bag with the hose and hosing it out. And I'm going to clean it dry, and I'm gonna leave it here for the next nurse to clean it up when it gets full. Then I'll make sure that the patient is comfortable. Ask them if I can get them anything. I'm going to lower the bed. And then I'm going to leave their call light within reach. ask them how they felt, and I will leave the room.
Okay.
Hello, Mr. Brody. I am coming in here to just give you some special teachings about how to take care of your ostomy bag. They do make deodorizing pills and liquids you can put in your ostomy bag, just if it makes you a little uncomfortable to begin with, so we can definitely get you some of those. We also do change it if it's 3/8 or 3/4 of an inch.
1/3.
Oh, 1/3 full. So we'll keep an eye on that while you're here. Let us know if you have any difficulties. Let us know if you start feeling any different, if you see any pus, drainage, inflammation, redness around the site, or if you just start feeling icky, we'll definitely check on some labs for you, okay? Everything else looked good. Stoma size looked good. We didn't see any pus or drainage today. We do encourage you to eventually start feeling around it, taking a look at it. I know it might be a little disconcerting at first, but the more you start, the faster you start to do it, the more able you'll be to be okay with it and be able to change it by yourself.